Thanks, Denise. The Cheryl Burman Award is presented annually to a person, a group of people, or to a project where outstanding work has been carried out in a field of endeavour related to addressing and working towards eliminating viral hepatitis in New South Wales. The award pays tribute to Cheryl Burman, who provided exceptional leadership in the early days of the New South Wales viral hepatitis response. Cheryl served on the board of the Hepatitis C Council of New South Wales from 1993 to 2000, including as president from 1995 to 1999. Cheryl made significant contributions to the governance and leadership of Hepatitis New South Wales. Sadly, she passed away in 2011 after a long and difficult struggle with hepatitis C-related liver disease. The inaugural Cheryl Burman Award was presented in 2013, and there have been 6 additional recipients since then, with dedicated and outstanding people from across clinical, research, and community fields taking the honour. This year has seen an equally diverse range of outstanding nominees for the Cheryl Burman Award. Once again, the applications we received demonstrated strong leadership and initiative in the sector. The Hepatitis New South Wales Board is proud to announce the following finalists for this year's award. Professor Bob Batey, in recognition of his long and distinguished career of service to communities affected by viral hepatitis through research, clinical excellence, prioritising patient needs, and advocacy. It also recognises his commitment to making treatment accessible to all affected communities, whether in custodial settings, regional, rural, or remote locations, through the development of local treatment and care services. Bill Lenane, in recognition of his long-standing and ongoing commitment and efforts in advocacy and representation, as well as his achievement in increasing the profile and voice of people with lived experience of hepatitis C. It also recognises his ongoing community work and health promotion activities in the Illawarra Shoalhaven. Sinead Sheils, in recognition of her substantial contribution to the improvement of quality of the lives of people living with viral hepatitis through negotiating and adapting clinical activities, ensuring the greatest outcome for all stakeholders, including clients. It recognises her outstanding contribution to building workforce capacity and evidence-based best practice. I'm proud to announce that the winner of the 2020 Cheryl Burman Award is Professor Bob Batey. Professor Bob Batey trained at Sydney Hospital, Royal Prince Alfred Hospital, and the Royal Free Hospital in London. This training was the start of a 50-plus year career, which has included internal medicine, gastroenterology, hepatology, and substance dependency medicine. He has held numerous prominent positions within the hepatology sector, providing clinical guidance and expertise in frontline clinical roles, as well as policy development and leadership positions at state and national level. As an advocate for the affected hepatitis C community, Professor Batey was a member of the group of clinicians who lobbied the federal government to ensure equitable access to treatment. The first subsidised treatment for hepatitis C, interferon, was listed on the Pharmaceutical Benefit Scheme in 1994 and was placed under the management of Professor Batey and the National Interferon Database. Collaborating with Hepatitis New South Wales in 1995, he devoted many hours and much energy to provide education to the public, dispelling myths and reducing stigma and discrimination experienced by the affected community. He was the first visiting medical officer to provide hepatitis C treatment and care services in New South Wales custodial settings, treating his first patient in 1996. Professor Batey visited many regional and rural locations within New South Wales to assist in the education of staff, leading to the development and commencement of hepatitis C treatment and care services in places such as Coffs Harbour, Tamworth, Port Macquarie and Lismore. He has also supported the southern part of New South Wales providing visiting medical officer clinics to Wagga Wagga, Albury and Nowra. In 2002, Professor Batey was made a member of the Order of Australia for services to medicine in the field of hepatitis C, medical education and research. Professor Bob Batey has always put the needs of the patient and the affected community as a priority, to ensure their needs are not only heard but addressed. Hepatitis New South Wales congratulates Bob and recognises all of this year's finalists for the Cheryl Burman Award. Ladies and gentlemen, Professor Bob Batey.
I'm deeply honoured to be deemed appropriate to receive the Cheryl Burman Award this year. To the CEO, the President, the Board of Hepatitis New South Wales, I say sincere thanks for the privilege of being here and speaking to the acceptance of this award. Cheryl did much in her time before she sadly passed away to improve the lot of those who are at risk of and those who are suffering or were suffering from hepatitis C. And it's so exciting to be part of a group of people in this country and around the globe who have done so much to improve how people experience hepatitis C in this day and age. It's so exciting that we now have a cure which is so easy to give and so effective and with so few side effects. Cheryl would have been aware of all of the complications that our older treatments for hepatitis C created. It is wonderful that Hepatitis New South Wales is able to recognise the work of Cheryl, and it is exciting that they have been able to create this award to recognise those who have worked in the field over the years. Looking at the list of those who've received the award in previous years, I see a number of faces with whom I've worked and spent many hours trying to improve hepatitis C and hepatitis B related issues in New South Wales and beyond our borders. People like Gail in particular remind me of some amazing travels we had out in Western New South Wales as we sought to improve services out there in that part of this amazing state of ours. Others I've sat around large meeting tables with for many hours debating what we might do better in the time ahead of us in those days. It's been a really exciting journey, and I do still continue the journey working out in the Northern Territory, hoping to travel there actually tomorrow to do some more work in both Hep C and Hep B in that incredible part of the country. Then with links to Alice Lee's work with Hep B Free and with Asham, it's always something there that is a challenge to think about and to try and contribute to. I am deeply honoured and humbled by this award. I still don't believe I deserve it, but I'm very grateful to receive it. And I thank everyone who's been part of the process that has led to this event this evening. Thank you sincerely, and I hope to continue doing hepatitis-related work in the days ahead. Thank you.